Hello all, today we will discuss about developmental assessment. Prerequisites. Place free from distractions. Child should not be hungry, tired, ill or irritated. A playful mood with his mother or caretaker around. Adequate time should be spent in making the child and family comfortable. Development kit. Equipment for development assessment. A red ring of diameter 6 to 7 cm tied to a string, 9 red cubes, paper pellets, spoon, cup with handle, a book with thick pages, picture book, red pencil, paper, doll and mirror. Steps. First, a detailed history to be taken to know the probable risk factors affecting development, evaluation of rate of acquisition of skills and differentiating between delay and regression, forming a gross impression about the development age of the child. Next, examination. Assess physical growth, assess head circumference, look for any dysmorphism, stigmata of intrauterine infections and signs of hypothyroidism, screen for vision and hearing, neurological examination and examine for primitive reflexes if required. Observe the baby, social responsiveness, alertness, concentration, interest and distractibility, assess vision and hearing, vocal responses, nature, frequency and quality to be assessed, fine motor skills, interest, alertness, rapidity of responses to be assessed. Annoying manners like assessment of reflexes, head circumference measurement, ventral suspension and pull to sit should be done at the end. Also perform development assessment before the systemic examination. Significant delays on screening is an indication for a detailed formal assessment of development status. Development quotient. Development quotient is average age at attainment divided by observed age at attainment into 100. If development quotient is less than 70%, then there is delay and should do a detailed evaluation. There are several tests to assess development quotient. Each test has its own psychometric properties, overall score of development and subscores for gross motor, fine motor, visual perception, receptive language, expressive language. IQ tests mainly assess the cognitive or adaptive behavior part of the development. Specific IQ tests like Stanford Binet intelligence scales are available to assess IQ testing from 2 years of age. Interpretation. In babies born preterm, corrected age rather than postnatal age is used for determining developmental status till 2 years of age. Example, a child born at 32 weeks of gestation, that is gestational age, seen at 12 weeks of age, that is postnatal age, should be considered as a 4-week-old, that is corrected age. Range of normalcy. We should remember the wide variations in normalcy, that is, milestone, for example, considering the milestone of standing, average age for attainment of this milestone in a WHO survey was 10.8 months. But the third and 97th centile for normal children were 7.7 and 15.2 months. So here we can see the range of normalcy for sitting without support, standing with assistance and all. For example, sitting without support, like 3.5 months to 9.5 months. Standing with assistance, 4.5 months to 11.5 months. So in all the milestones, there is a range of normalcy. Retardation should not be diagnosed or suggested on a single feature. Repeat examination is desirable in any child who does not have a gross delay. We should also consider recent illness, significant malnutrition, emotional deprivation, sensory deficits, neuromuscular disorders, opportunities provided to the child to achieve the milestone. Example, a child who has not been allowed to move around on the ground sufficiently by the apprehensive parents may have delay in gross motor skills. Next, dissociation. There can be significant variations in attainment of milestones in individual fields. Example, a one-year-old child who speaks 2 to 3 words with meaning and has finger-thumb opposition 10 to 12 months may not be able to stand with support less than 10 months. That require evaluation for physical disorder. So let's see upper limit of age for attainment of milestone. Visual fixation or following 2 months, vocalization 6 months, sitting without support 10 months, standing with assistance 12 months, Hands and knees crawling 14 months. Standing alone 17 months. Walking alone 18 months. Single words 18 months. Imaginative play 3 years. Development screening test. It aids early intervention services. All children should be periodically screened. At least those with perinatal risk factors should be screened. Developmental surveillance. During surveillance, repeated observations on development are made over time to see the rate and pattern of development. Periodic screening helps to detect emerging disabilities as the child grows. Use periodic screening tools for ongoing developmental assessment. Screening tests popular in West are parents' evaluation of development status, ages and stages questionnaires. Common screening tools used in India are FADEX Baroda Screening Test, Denver Development Screening Test, Trivandrum Development Screening Test, Clinical Adaptive Test and Clinical Linguistic and Auditory Milestone Scale, Good Enough Harris Drawing Test. Thank you.